there's been a lot of talk about COVID, the COVID vaccine, vaccine injuries and excess deaths. And I completely understand that, and Rennie and I have talked about this a great deal, and I thought it would be worth actually diving into the statistics to actually understand what the reality is. Now, the death toll in 2023 is nearing pandemic levels, and the absence of an explanation is leading to wild theories. And experts are warning that what we need is an urgent investigation into the matter to curb dangerous theories, but also to get the truth. And I think it's really important that we do get the truth. Chris Whitty has been told, the Chief Medical Officer, that he needs to launch an urgent inquiry into excess deaths. I will read some of this because it's really important. So what people are questioning is, why are excess deaths higher and near pandemic levels, and why is that? So government figures show the number of extra or unnecessary fatalities is higher than in 2021 and in 2022, and on a trajectory that would even surpass 2020. The biggest concern is those people aged 15 to 44. And those deaths are higher than in other years, including 2020. That was the year, obviously, of the COVID outbreak. Now, there are lots of theories about why this is. Is it because of delayed medical treatment? Is it because of the impact of the pandemic measures? Also, is it because people didn't get their prescriptions because they couldn't see a doctor? Also, was it to do with the doctor's strike? Well, the BMA says that isn't the case. Just in terms of this, obviously lots of theories are being spouted. We know that any medication, any vaccine has side effects. And the question is, what's cause and effect, and what should we be looking for, and what is the truth? Well, joining us now is Jamie Jenkins, who's a statistician and political and economic commentator. Very good morning to you, Jamie.
Good morning, guys. How you doing?
Morning, good, thank you very much indeed. I'm really pleased we're doing this because it's really important that we base everything in fact, and you're the man to go to. So tell us where we are. I said that these excess deaths are higher than in other years, and particularly of concern the 15 to 44-year-old age group.
Yeah, I suppose it's probably worth just starting. What do we mean by excess death?
Yes.
So basically then, what we did in the pandemic, so 2020, 2021, we would compare the number of deaths we saw there to, say, the 5-year average going into 2020. So that's like kind of that first year that the pandemic hit. And so naturally we would look at 2015 to 2019, and then you say, oh, we've seen far more deaths now in this year than what we saw in that period of time as well. So, and that's a general method that you would normally do. The issue you have when you start getting towards 2023 is you are going quite far away from 2015 to 2019 now. And people will say, well, it shouldn't really matter, should it? So one big event that did happen around 75 to 80 years ago was the end of the Second World War. And what that meant, if you look at any population kind of structure of the UK population, we had a big bulge in new births around 75 to 80 years ago. And a lot of those people are now hitting the kind of the age that you would expect them, sadly, to start dying. So when you compare, say, 2015 to 2019, when they were in their 60s and coming into kind of the early 70s, they were less likely to die than what they would be now in 2023, where they're getting a lot closer to 80 years old. So if we look at the numbers, David, overall, what we've got is that so far this year, we've seen about 430,000 deaths. And if we compare that 2015 to 2019 period, it was about 391,000. So there's 39,000 more deaths, which sounds a big number, quite alarming, about 10%. Now, what you should do, though, is, and what I've done is you look at the kind of your chance of dying. So we know as you get older, you're more likely to die. So if you look at how many older people, and, you know, look at every different age group in the population, look how many people we have in those age groups. And then if you multiply those by the chance of dying before the pandemic, so looking at 2015 to 2019, then because you've got a lot more older people, and even if their chance of dying was exactly the same, you would expect more deaths. So if you break it down, you would expect probably about 426,000 deaths, which is higher than that average of 391, but it still shows about 4,000 more excess deaths, which is only closer to 1%. But when you really break down, we can perhaps discuss this in a little bit more detail, when you do break it down by kind of different age groups, the concerning thing is we are still seeing that 10% excess in people under the age of 55, and it's acutely kind of bad in the 35 to 54-year-old age groups.
So we'll show you some graphics in just a moment about what the numbers actually show. And I appreciate this is very complicated. So just extrapolating from what you're saying, this age group, particularly in this younger age group, is of concern.
Yes, no, definitely, because obviously you would expect the same number of deaths if the chance of dying was exactly the same. And we can explain a lot of the big number of overall deaths because we've got a big cohort of people after the Second World War who were in that kind of age where they sadly would be reaching the kind of the average life expectancy. But we are still seeing, say, about 10% more deaths than what you would expect to see when you look at the numbers of people who are aged 35 to 54 in the population compared to that pre-pandemic thing. And you've already alluded to a range of different factors here. And I think just talking about the vaccine, I think one thing that people do cite, we sadly do know that people have died tragically from adverse reactions to the vaccine. But Sweden is one of those countries that has one of the lowest excess deaths across the world. And they've got a higher vaccination rate than the United Kingdom as well. So just looking at that as an explanation for all of it, well, other data would suggest that there must be other explanations as well when you look at it in the round.
So it's very difficult, as you say, to disentangle some of this, because I'm glad you said that in some rare cases the vaccine has caused some deaths. Also, we know that there have been side effects such as myocarditis caused by the vaccine. I know that only too well. My mother got that from the vaccine as well. The problem here is, because no one is talking about this apart from Dr. Rennie, me and you, then there's a void, and that void is then filled by everyone coming up with their own theories, and that is very problematic.
Yeah, and so if we just look at that, say, 35 to 54 year age group, so if we talk about maybe 40,000 excess deaths overall, David, then that's a lot of deaths to start looking at individual death certificates. But we can explain quite a bit of it because of the aging population. But we can't then explain, with us just chatting here, why are we seeing 10% excess deaths, say, in the ages 35 to 54? Because remember, if you start looking at kind of average years of life lost, if somebody dies prematurely when they're 75, that's a lot fewer years lost than somebody who's dying when they're in their 30s. So all the government really needs to do is they should have access to individual patients' medical records. They obviously have the causes of death. And so we can start looking to understand how much of this is because somebody maybe died of cancer prematurely because they had a misdiagnosis. How many people kind of didn't get the ambulance turn up on time because we know we've had ambulance delays. How many people actually had vaccinations, COVID infections. So you can get a small cohort and do a study of, say, the 4,000 or 5,000 deaths that may be excess in those younger age groups. That might be a better way of trying to disentangle it, rather than just kind of this silence that's going on from government. I think
so Jamie, before I bring Dr. Rennie in, let's just look at these graphics, and they are very good graphics indeed. Let's look at the first of these. This is the number of deaths registered by week in England and Wales. It's quite difficult to see on this. Just tell us what we're looking at here, because we can see peaks there, and then obviously it tails off.
Yeah, and obviously for those listening on the radio, what it is just shows kind of a bar and every single week the number of deaths. So if you look at 2020, it goes from the start of 2020 all the way up to the latest data that we've got for September 2023. And the bars are showing how many deaths you're seeing. So you do see some spikes, some big spikes actually during the first wave of COVID. Didn't last too long. And then you see some spikes during the second wave of COVID. And then you got some lines on there. So the black line shows the number of average deaths that we saw in that period, 2015 to 2019. But then what the white line is showing is how many deaths you would expect if you account for that aging of the population and the age structure changes. So you can see that the bars aren't as high above the white line as what they're above the black line. And that's kind of why if you only compare the numbers to the average of 2015 to 2019, you get much bigger numbers of excess. But you've got to account for that age, structure that we've just been talking about.
Indeed. Let's move on to our second graphic, and this is the cumulative number of deaths registered in England and Wales. So do you just want to talk us through that and just reiterate your points?
Yeah, so this is looking at 2023 overall, and it breaks them down by some of the age groups. And what the table is kind of reaffirming what we've just discussed is that we've seen 430,000 deaths in 2023 so far that's been registered. We would, if it was just comparing that 2015 to 2019 average, expect about 391,000. So that's where that 10% number, or close to 39,000 deaths are. But the kind of the middle bit there is looking at how many you would expect when you do adjust for all of the age. Any statistician would normally do that, and you can see it's only 0.9%. But what the bars do show is those younger age groups are still above, and that's kind of where I think the public deserve, the government to be putting their own data and analysis out there. They've got access to it all. I think there's, we deserve some answers on that.
Well, I couldn't agree more. Dr. Renee.
So we do, Jamie, and I think this is where we need to concentrate. And when we get the government, as Jamie says, if we can get the government to give us explanations, the things we need to be looking at are, firstly, the health of the population. Did more people die with us than Sweden because our population was less healthy to start with? That's number one. What did the vaccination play a role? That's a really important point. Did we lock people out of medical care and so they didn't get diagnoses that wouldn't have killed them if they had? These are all the things we want to know. Did suicide go up because we were locked down? Sweden were not.
Did people drink too much?
Did people drink too much? But the other thing that we need to know is, there have been doctors, Dr. Angus Dalgleish, for example, who's been talking about accelerated cancers. And, in this younger age group, did the vaccine or not, and I'm quite prepared to accept whatever the answers are, accelerate cancers that these people would not have died from?
And I agree with you completely, and obviously, as you know, I have personal experience of this, where a cancer has been diagnosed which wasn't there before the vaccine. I want to know, is there cause and effect from that vaccine? And all we're saying is we need the data and we need proper analysis.
We do. And it's hard to unpick now because lots of people have had COVID, lots of people have had the vaccine, lots of people have had both. So it's actually very hard to unpick.
Jamie?
Yeah, I think one thing to add on what Renee's saying there is that I've seen some kind of analysts who I can respect in the field have been looking at kind of excess deaths across many different countries. And then you can overlay on that what is called a stringency index, which is kind of how stringent were the government measures. So you might go from obviously one where there's extreme lockdowns, kind of Chinese style, New Zealand style border talk, to kind of more Sweden style. And there does seem to be a correlation that the countries that had the tougher restrictions do seem to have the higher excess deaths overall. And so is that to do with, remember what the government said at the time? They said, stay home, protect the NHS. Now, the government would argue that was just, stay home so that you didn't get infected to need to go to the NHS. But a lot of people took that, David and Rennie, is that stay home, protect the NHS is, I'm not going to bother the GP. I'm not going to go and
100%.
see to the hospital, which then meant that there was a lot of misdiagnosis and delayed diagnosis, which you talked about with cancer there. And importantly, you can't divorce the fact that we are still in a period where you've got massive, massive waiting lists. Now, a lot of these people on waiting lists aren't for emergency treatment. They would be prioritised. But there will be some link there between, protect the NHS, people staying home, and then sadly dying because they didn't come forward as they would have in a normal year to get some treatment.
Because they were being asked to save lives.
So that's really interesting. Words matter.
Yeah.
And so that phrase, whilst well-meaning, and I understand why they did it, actually had unintended consequences.
For sure.
No, I think definitely, because I think my friends that I talked to, they said, oh, yeah, I don't want to bother the GP. You've only got to look at the attendances to A&E data. When we started in the pandemic, fell down quite dramatically. People weren't going to see the GP. But also, it wasn't just that. Remember what GP surgeries were doing, you couldn't get the face-to-face appointments.
Well, still
things
can't.
like and you still can't with some. They are increasing, it's getting back more towards what it used to be, but it's still not the same. So those things where you might just go and see the GP and just suddenly say, oh, yeah, I've got a bit of a lump here as well. And it might be something that you didn't actually go to see them. And then, oh, that's quite concerning. Those are the little things that you miss.
So I guess, Jamie, though, the only anomaly here is that people in this age group are generally reasonably fit and healthy. So we wouldn't expect them to be getting cancer so much or dying so much. Of course, there are so many things that contribute. They stayed at home. Perhaps they got fatter. Perhaps they got diabetes. Perhaps they stopped exercising. There are so many things. Perhaps they drank more. Perhaps they were more exposed to domestic violence. We know the stats say they were. There was a lot going on.
But also let's bring in personal experience, and really you can't do that. You can't use individual cases, but in this case I think it's worth it. I talked about my mum, but also as you know, Max Harrison, who's one of our Future Politics panel, professional ballroom dancer got myocarditis
one of my patients from Moderna cannot
from
go
the vaccine.
He actually has permanent heart damage.
So does Max. So again, we have to. So then you end up with other questions. Why did we vaccinate young people? Should we have vaccinated young people? And should we have locked down, Jamie? I mean, these are huge issues. Actually, on that, Anne's just messaged saying, David, 3 members of my extended family died of heart attacks from September the 21st to September the 22nd, all following the booster. 2 were in their 80s. 1 niece was 46. Yeah. Now, that's very difficult to answer. Anne goes further and says, why isn't the government interested?
Well, the government should be interested, and I think this is where the COVID inquiry should be also having a proper look at, because I think, unfortunately, the COVID inquiries seem to be wondering, should we have locked down earlier, those kind of questions. But should we, I think, you know, that first wave of the pandemic, nobody really knew what was going on. And there was a bit of groupthink, as in we'll follow every other country. So it was kind of, you would have been an outlier if you hadn't done that. But throughout the pandemic then, there was policies where we were locking down when ultimately everybody was going to probably catch this virus in the end. And Rennie made a good point about these younger people as well. We do know that we've seen the data actually from the NHS themselves citing some excess deaths due to kind of people dying with diabetes, because the checks for diabetes were kind of culled during the pandemic as well. So, you know, there are a lot of people out there with medical issues who were kind of left behind over the last 3 years. And the sad thing is that the NHS is currently in such a mess that it's never going to really catch up with the current way that we're doing things.
Yeah, absolutely.
So many questions on this.
So many questions. Look, and this is the problem, and as you know, I feel very strongly about this, but Tracy said my brother had no illness then. He had a jab, he got rapid cancer, he lasted 6 months, and he was only 51 years of age. And the government, I mean, she goes on to say that the government was at fault, the NHS was at fault and was responsible for his death. Now, we will never know the answer to that until we have open, honest, transparent debate, and we look at figures like yours and the government has a proper inquiry.
And we listen to our oncologists who are flying the flag here and raising a signal about this.
100%. And we're seeing cancer doctors saying something is really weird, something is odd, and we need to investigate it. Jamie, thank you so much for your time. You explained that brilliantly. Statistician and political and economic commentator. Do get in touch about that as well, and we'll come back to this over the next few weeks as well, because it's really, really important. Right, let's take a break. After the break, it's Sunday Surgery. This week we'll concentrate on alcohol. Really interesting one, this one. It's Sober October. Are you drinking too much? This is TalkTV.